Did you know some dementia symptoms appear years before memory loss starts? And most people over 60 completely miss them. That is dangerous because early action can slow serious brain decline. Many seniors think these signs are just normal aging, but your brain may already be sending silent warnings. Stay until the end because one of these symptoms often appears during everyday conversations, and most families never recognize it until much later. Welcome back to Senior Health Secrets Over 60. I am Dr. Jessica Reed. If you care about protecting your memory and staying independent longer, please subscribe and turn on the bell notification. Every week, I share trusted senior health advice designed especially for adults over 60. And today, you will learn the 6 silent dementia symptoms you should never ignore. Have you ever walked into a room and forgotten why? Have you struggled finding simple words lately? Maybe you forgot a familiar name or repeated a story twice. Most seniors brush these moments away. You tell yourself, everyone forgets sometimes, and that is true. But certain patterns can signal something much deeper. According to the CDC, nearly 7 million Americans live with Alzheimer's disease today, and the risk rises sharply after age 65. The World Health Organization says dementia affects memory, thinking, behavior, and daily functioning. But many symptoms begin quietly years earlier. What makes this frightening is how normal these changes can seem. Families often miss the warning signs completely. Many people delay help for years. During that time, the brain continues changing silently. I have spoken with many patients who said the same thing. They thought stress caused the problem, or poor sleep, or aging itself. Then suddenly daily tasks became harder. Bills were forgotten. Conversations became confusing. Confidence disappeared slowly. And here is the heartbreaking part. Early treatment and lifestyle changes can sometimes slow progression, but many people wait too long because they never recognize the signs. For over 15 years, I have worked with older adults facing memory and brain health problems. I have helped thousands of patients improve their daily habits and recognize serious warning signs earlier. But here is what most doctors never tell you. Dementia rarely begins with dramatic memory loss. It often starts with tiny, hidden changes most people overlook completely. The first silent symptom is trouble following conversations. This surprises many seniors. They expect dementia to begin with forgetting names, but often it starts during simple discussions. You may suddenly lose track of what somebody said. Group conversations become exhausting. You may nod along while secretly confused. Your brain processes speech very quickly. Healthy brains organize information smoothly, but early brain changes slow that process down. Words feel harder to follow. Conversations feel overwhelming. One of my patients, named Linda, noticed this during family dinners. Her grandchildren spoke quickly. Everyone laughed and changed topics rapidly. Linda started staying quiet because keeping up became stressful. She thought hearing loss caused everything, but her hearing tested normal. Here is what you should watch carefully. Do you often ask people to repeat themselves even when you heard the words clearly? Do conversations feel mentally tiring? Do crowded rooms suddenly feel overwhelming? A helpful tip is reducing background noise during conversations. Turn off televisions while talking. Face people directly, and challenge your brain daily with reading or puzzles. These small habits strengthen mental processing. But that is nothing compared to the next symptom, because number 2 often appears while driving or shopping, and many families mistake it for simple distraction. The second silent symptom is getting lost in familiar places. This does not always mean wandering far from home. Early signs can be subtle. You may suddenly forget a familiar route temporarily. Grocery stores feel confusing. Parking lots become stressful. You hesitate during normal drives. According to the National Institute on Aging, problems with direction and spatial awareness are common early dementia signs. Your brain relies on special areas for navigation. When those areas weaken, familiar places suddenly feel unfamiliar. One patient named Robert became anxious driving home from church. He had attended the same church for 20 years, yet one afternoon he missed several turns and panicked. He laughed it off later, but deep down he knew something felt wrong. This symptom can quietly reduce confidence. Many seniors start avoiding driving completely. They stay home more often. Isolation increases, and isolation itself can worsen brain decline. Please pay attention if familiar places suddenly feel confusing. Use phone maps if needed. Keep routines consistent. And talk with your doctor early instead of hiding the problem. Regular walking also helps greatly. Research from the NIH shows physical activity supports brain blood flow and memory function. Even 30 minutes daily can help your brain stay healthier longer. But the next symptom may shock you most, because many people think it is simply personality change, when actually the brain may be struggling silently underneath. The third silent symptom is mood and personality changes. This symptom often appears before obvious memory problems. You may become unusually irritable. Small frustrations suddenly feel overwhelming. Anxiety increases. Suspicion grows stronger. Some people become withdrawn completely. Families often misunderstand these changes. They say, "Mom became grumpy," or "Dad seems distant lately." But emotional regulation depends heavily on healthy brain function. One patient named Carol became unusually fearful after sunset. She worried constantly about small problems. Her daughter noticed Carol no longer enjoyed social events she once loved. At first, the family blamed stress and loneliness. Later, testing revealed early cognitive decline. According to the Alzheimer's Association, depression and withdrawal can appear early in dementia. Your brain affects emotions deeply. When brain cells struggle, emotional changes often follow. Please never ignore sudden personality changes after 60, especially if they appear alongside forgetfulness or confusion. Keep social connections strong. Isolation harms brain health significantly. And before I continue, if this is helping you, please take 2 seconds and hit that like button. It helps me reach more seniors who desperately need this information. And if you have a parent or friend over 60, please share this video right now. Now, the fourth symptom is one families miss constantly because it sounds harmless at first. The fourth silent symptom is repeating questions and stories. Everybody repeats things occasionally, but dementia repetition follows patterns. You may tell the same story several times daily without realizing it, or ask identical questions minutes apart. This happens because short-term memory weakens first. Your brain struggles storing new information correctly. Conversations reset repeatedly without you noticing. One patient named James repeatedly asked his wife about dinner plans every hour. At first, she thought he simply forgot occasionally, but over months, the repetition increased dramatically. Here is something important. Many seniors become defensive when loved ones mention repetition. That reaction is normal. Brain changes feel frightening. But recognizing patterns early matters greatly. Try using written reminders throughout your home. Sticky notes help. Calendars help. Voice reminders on phones can also support memory safely. Research from the CDC shows mentally active seniors may lower cognitive decline risk. Learning new hobbies helps greatly. Card games, reading, music, even simple daily routines strengthen brain activity. But the next symptom is especially dangerous because many seniors hide it from family members completely. The fifth silent symptom is poor judgment and risky decisions. This symptom appears quietly. Bills get forgotten. Scammers become more convincing. Spending habits suddenly change. You may neglect hygiene or medications. Your brain controls decision-making carefully. Early dementia weakens those systems. That can place seniors at serious financial and physical risk. One patient named Harold suddenly donated thousands of dollars to fake charities. His daughter became alarmed because Harold had always been cautious with money. Later, brain testing revealed early dementia changes affecting judgment. According to the FBI, older adults lose billions yearly to scams. Cognitive decline increases vulnerability greatly. This is why families must pay attention to unusual financial behavior. Please organize bills carefully. Use automatic payments when possible. Let trusted family members monitor unusual spending if concerns appear. There is no shame in asking for support. And now we reach the symptom that many doctors say appears very early, but gets ignored constantly because people blame aging completely. The sixth silent symptom is difficulty finding words. You may know exactly what you want to say, but the word suddenly disappears. Conversations pause awkwardly. You replace words with vague descriptions instead. This happens occasionally to everyone, but frequent word struggles deserve attention, especially when common everyday words become difficult repeatedly. One patient named Maria forgot simple names constantly. She called a refrigerator the cold machine. She laughed about it initially, but her frustration grew over time. Language relies on complex brain networks working smoothly together. Early dementia can disrupt those pathways quietly. Words become harder to retrieve quickly. Here is something many people never realize. Difficulty finding words can also cause social withdrawal. Seniors become embarrassed. They speak less often. Confidence drops steadily. A powerful brain tip is reading aloud daily. This strengthens language pathways. Singing songs helps too. So does regular conversation with family and friends. According to the NIH, staying socially active supports better cognitive health later in life. Human connection matters deeply for your brain. But there is one more hidden issue connected to all six symptoms, and this may be the most important part of today's video. Many seniors believe dementia is completely unavoidable. That simply is not true. While age increases risk, certain habits strongly affect brain health. Poor sleep harms memory deeply. According to the CDC, adults need 7 to 8 hours nightly. During sleep, your brain clears harmful waste products. Chronic sleep problems may increase dementia risk over time. High blood pressure also damages brain blood vessels silently. The American Heart Association warns uncontrolled blood pressure raises dementia risk significantly. Blood sugar matters too. Diabetes can damage blood vessels supplying the brain. This reduces oxygen and nutrient flow gradually. One patient named Susan improved dramatically after controlling her sleep and blood sugar. Her confusion lessened. Her focus improved. She felt mentally sharper within months. This is why brain health requires whole body health. Your heart affects your brain. Your sleep affects your brain. Your diet affects your brain. Now here is exactly what you need to do starting today. First, protect your sleep carefully. Keep consistent bedtimes. Avoid large meals late evening. Reduce screen time before bed. Good sleep protects memory strongly. Second, move your body daily. Walking improves brain blood flow. According to the NIH, regular exercise supports memory and thinking skills. Third, challenge your brain often. Read books, learn small new skills, play memory games. Mental stimulation keeps brain pathways active. Fourth, stay socially connected. Call family regularly, join community groups, attend church activities. Isolation can accelerate cognitive decline. Fifth, control blood pressure, blood sugar, and cholesterol carefully. These numbers matter greatly for brain health after 60. Sixth, never ignore early warning signs. If you notice these symptoms consistently, speak with your doctor early. Earlier evaluation provides more options and support. And finally, nourish your brain daily. Eat more vegetables, berries, nuts, fish, and healthy fats. The Mediterranean-style diet has shown strong brain health benefits in many studies. Please remember this clearly. Forgetting occasionally does not automatically mean dementia. But patterns matter, consistent changes matter, and early action matters most. Today we talked about 6 silent dementia symptoms many seniors overlook. Trouble following conversations, getting lost in familiar places, mood changes, repeating questions, poor judgment, and difficulty finding words. These signs often appear quietly, gradually, sometimes years before serious memory loss develops. That is why awareness matters so much. I want you to understand something important. Dementia does not define your worth. Many people live meaningful, fulfilling lives while protecting their brain health proactively. Early support truly makes a difference. If any of these symptoms sound familiar, please do not panic, but do not ignore them either. Talk with your doctor, share concerns with loved ones, and start supporting your brain today. Now, I would love hearing from you. Have you or somebody you love noticed any of these symptoms after 60? Please share your experience in the comments below because your story may help another family watching today. And if this video helped you, please like, subscribe, and turn on notifications so you never miss future senior health videos. I have another important video coming soon about hidden daily habits silently damaging memory after 60, and you do not want to miss it. I am Dr. Jessica Reed, and I will see you next video. The information in this video is for educational purposes only and is not intended as medical advice. Always consult your doctor before making any changes to your health routine.